Hello, my name is Adriana Cano, and I am a Community Health Early Intervention Specialist at DAP Health. As an early intervention specialist, my role is to connect clients to available resources when they need them the most. One of the programs that I work with is a program called MR. It is a web-based platform for HIV-negative adults 18 and over. Via this program, clients are able to consult with a doctor, test for STIs and HIV, all from the comfort of their own homes. Many people do not get tested due to fear of judgment and privacy. This program eliminates that. Today, I'll be reading a letter from an individual who became a client through our partnership with MR and wishes to remain anonymous. Hi everyone, I would like to start this letter by apologizing for not sharing my name, but unfortunately there are still people in my family who do not have a good education, and perhaps I would not like to see them hurt. Back in January, I learned of the MR program and signed up as a new client. And on January 6, 2022 was one of the most terrible days of my life because I received an HIV positive status. And perhaps based on my perspective and lack of information, I thought it was a death sentence. After learning my status, I received a call from what I now consider my guardian angel, Adriana Cano. And I decided to stay at the clinic to be treated because from the first call, I felt an impressive connection that made me feel like family. From the first visit to DAP, they treated me as what I am, a human. My fear was so great that I did not want to look anyone in the eye. I went immediately to receive my first consultation, and my world changed 180 degrees. Through the clinic and Adriana, I found a family that I did not know existed. They took me by the hand to achieve a mental and emotional peace that I don't think I was going to find again. Within all this that I call my little hell came the most difficult question to understand. How am I going to get everything I need to be with an undetectable status since my economic characteristics did not allow me to even dream? And my guardian angel returns to move my life and gives me the alternative that once again, I am not alone. To this day, my heart and soul are a little more at peace, and I realize that I am not alone. I got a small family that is not going to leave me alone, and today I live in an undetectable status. I live in peace and with the mentality that I am not alone. Thanks, Adriana Cano, Arturo Hernandez, and of course to all my medical guardian angels and medical assistants who have not left me alone. And I will stay with you because of life and God Himself gave you to me as a new family. Thanks for everything. In this letter, it mentions that I called the client. The first call comes from a doctor that is associated with MR. They then proceed to give the client various test results. If a client receives an HIV positive result, then I make the phone call. My call is mainly to ensure that the client knows they're not alone and there are resources and care available to them. There is no obligation from a client to receive services here. It is simply a means of outreach for the client to know of resources and care available and to know that they are not alone. Thank you to DAP Health for allowing me to do this kind of work, and thank you for allowing me to share my client's story tonight. Thank you.